Hello everyone, my name is Aditi and on behalf of the Healthy Cooking for Less group, today we're going to be addressing food and diet misconceptions. Here are a list of misconceptions we'll be going over in this video today, starting off with dairy is bad for you, organic is always better, the fewer the carbs the better it is, and eggs should be avoided if you have high cholesterol. Before we get started on discussing these common food and diet misconceptions, I'm just going to briefly address the fact that there are several challenges with diet and nutrition research. So nutrition behaviors are complex and variable, and the outcomes are only often meaningful in a long-term period. As a result, there are several practical and cost limitations that exist when devising and executing nutrition studies. There are also several confounding factors that can affect the results, such as other lifestyle interventions. Controlled feeding trials, which tend to be the best way to provide evidence in nutrition and diet research, are not always practical. And given all of these challenges, it can be hard to understand and interpret information about diet and nutrition, so it's important to always seek the advice from professionals, for instance, healthcare practitioners or registered dietitians, and reputable sources, such as high-quality articles, things like systematic reviews and meta-analyses, or high-quality websites. For instance, Harvard Health tends to be an easy resource that most people can access and understand that can provide some insight into diet and nutrition research. So starting off with our first misconception, dairy is bad for you. So what exactly does the evidence say on this matter? So the evidence is fairly mixed, and typically the type and amount of dairy consumption matters. So the Physicians Committee for Responsible Medicine suggests that dairy is a major source of saturated fat and therefore contributes to heart disease, diabetes, Alzheimer's disease, and cancer risk. Some research also suggests that while dairy is commonly recommended for calcium intake for bone health, the dairy consumption is not actually linked to bone health. However, on the other end of the spectrum, a 2021 systematic review, so again, a high quality of evidence, suggested that daily intake of low or non-fat dairy products may be associated with improved bone mineral density and fewer fractures. So from a standpoint of dealing with high risk for things like osteoporosis, or if you're prone to frequent fractures, dairy consumption might actually be beneficial for you. Additionally, a 2018 study presented that the European Society of Cardiology Congress found no association between dairy consumption and cardiovascular disease. It's important to note that there was a small association between milk and cardiovascular disease, but this was only in high consumption. So in individuals who were consuming about a liter of milk a day, there was a positive association with cardiovascular disease, but low to moderate consumers did not have any association with cardiovascular disease. Additionally, some research studies indicate that fermented dairy products, so things like yogurt, may have protective cardiovascular effects. So to answer the question, is dairy bad for you? The answer is we don't know. The research is fairly mixed. There is conflicting evidence. However, the general consensus based on recent evidence is that moderate consumption of dairy is likely not linked to any adverse events. So if you're someone who enjoys putting some dairy in your coffee or having some yogurt, this is probably not going to lead to an adverse event down the line. However, excessive consumption of dairy may still be linked, so it is a good idea to try and reduce your dairy consumption, but cutting it out completely is not necessarily required unless that's something that's feasible to you or you feel better without consuming dairy. The second misconception is that organic is always better for you. So this is a fairly common misconception. We tend to associate the word organic with something healthy and thinking that therefore if we go for the organic products, they're always the better and more responsible choice. So let's just define the terms organic versus non-organic. So organic foods are grown without the use of artificial chemicals, hormones, antibiotics, and genetically modified organisms, or GMOs. Non-organic foods are exposed to synthetic chemicals that boost their growth. So in terms of what the evidence says, it looks like organic foods may have more nutrients than non-organic foods. So various studies find that antioxidant levels can be up to 69% higher in organic foods. Nitrate levels can be up to 30% lower in organic foods. Nitrates are a particular chemical compound that has been associated with future cancer risk. The level of cadmium, which is a toxic metal, is up to 48% lower in organic foods. And when looking at dairy products, organic milk specifically contained higher levels of omega-3 fatty acids, which are a beneficial form of polyunsaturated fats. It also contained higher levels of iron and vitamin E, but lower levels of selenium and iodine. Additionally, eating organic can reduce your exposure to pesticide residues and antibiotic-resistant bacteria. So this seems to paint the picture that organic foods do have more nutrients than non-organic foods, and there might be some benefits there. However, while organic foods may contain more antioxidants and nutrients and have that reduced pesticide exposure, it's important to note that regular food is still within limits and regulations. So in order for any product to be commercially available in terms of food products, whether that be produce or processed products, they do have to meet certain limits and regulations. So regular food is still well within those limits and regulations. It's just that organic food, the research suggests, might have a little bit more nutrients. However, organic food can also cost more and spoil faster. And the evidence on the benefits of eating organic long-term is fairly mixed. So while some research does indicate that there are positive effects with increased organic food consumption, most of these studies also cite that the parameters involved in the investigations are not enough to indicate the true value of organic food. So while there is something that's observed, they can't draw any sort of conclusion about a causal relationship. So as a result, since the evidence is fairly mixed, with research indicating that there might be some benefit but not being able to conclude anything concrete, the idea of should we be eating organic or not ultimately comes down to a lot of personal choice. So if we ask ourselves the question of when is it appropriate to eat organic, well, there is one list that we can consult. So the Environmental Working Group publishes a list of foods, so organic versions of foods that should be purchased, and this list is called the Dirty Dozen. They release a new one every year. So if we're referencing the Dirty Dozen, consumers should aim to purchase the organic versions of these foods on this list. So the Dirty Dozen for 2022 is strawberries, spinach, kale, collard and mustard greens, nectarines, apples, cherries, peaches, pears, celery, and tomatoes. So the next misconception is the fewer carbs, the better it is. So oftentimes low carbohydrate diets are a common go-to when people are trying to lose weight, and they assume that cutting carbohydrates is going to inherently have more benefits and be a healthier choice. Now, what's important to note is that the type of carbohydrate matters. So whole grain consumption lowers the risk of developing cancer, decreases LDL, which is your lousy cholesterol, and reduces the risk of type 2 diabetes. Replacing refined grains with whole grains may be effective in attenuating excessive weight, dyslipidemia, and high blood sugar. Complex carbohydrates and carbohydrates lower on the glycemic index and load scale can have many beneficial nutrients without that effect of significantly spiking your blood sugar. Additionally, if you're eating the carbohydrate in the context of a meal that is also well balanced, it's not going to be inherently bad for you, and we can kind of modulate how much it might spike your blood sugar. So if the question you're asking yourself is, should I reduce carbohydrate consumption? Well, for the best health benefits, reducing refined sugar and simple processed high carbohydrate consumption, so things like white sugar, processed baked goods, etc., is probably a very good idea. And replacing these with whole grains, things like quinoa, bulgur, and whole wheat products or oats can be also very beneficial. So it's important to note that carbohydrates are a macronutrient that we need. We can modify the sources of carbohydrates without necessarily having to cut them out. So it's important to get your carbohydrates from fruits, vegetables, and grains rather than refined and highly processed products. Now on to our final misconception, eggs are bad for cholesterol. So this is something that originated decades ago, where we thought that the egg yolk that's present in eggs has a high cholesterol content and therefore is a major contributor to your blood cholesterol levels. So while it was previously assumed that the cholesterol in egg yolks was contributing to high cholesterol, recent research actually indicates that the cholesterol made by the liver, so the levels that we're measuring in our blood, does not actually come from dietary cholesterol consumption. This is actually influenced by the intake of saturated fat. So when we consume saturated fat, our liver processes this into cholesterol, and this is what we're able to measure in our blood. So given this information, the major contributor to high blood cholesterol is actually saturated fat. So if we're considering eggs actually do not contain much saturated fat. So one large egg is equivalent to about 1.5 grams of saturated fat. Moderate egg consumption, so one egg or two egg whites a day, is likely not linked to any adverse effects. And the effects of egg consumption on dietary cholesterol are therefore assumed to be quite small. So if the question is, should I be eating eggs? Well, eggs are a convenient source of protein with various nutrients, and they tend to be easily accessible for a lot of individuals. The saturated fat content in eggs and cholesterol in egg yolks do not have a big impact on blood cholesterol. And current research indicates that low to moderate egg consumption, so no more than 1 egg a day or 2 egg whites a day, is likely okay. So now that we've gone through those dietary and nutritional misconceptions, let's kind of discuss how that all ties in together. So essentially what we can draw from this discussion today is that there are many myths and misconceptions about diet, and nutrition research is challenging and subject to change. So it's important to always consult professionals and high quality evidence when formulating your opinions about food and diet. Speaking to the specific misconceptions we discussed today, we learned that the evidence is pretty mixed on dairy consumption, and low to moderate consumption is likely not linked to any adverse effects. We also learned that organic is not necessarily always better for you, though it might have more nutrients. The evidence is a little bit mixed on that, and it comes down to personal choice, though it is recommended you buy organic produce from items on that Dirty Dozen list. When it comes to reducing your carb consumption, we discussed how the types of carbohydrates you're consuming is more important than the volume that you're consuming. And finally, when it comes to eggs, we discussed that the saturated fat content in eggs and the cholesterol content in egg yolks is likely not a big contributor to your blood cholesterol levels. And as such, low to moderate consumption, so no more than 1 egg a day, is likely okay. Here are some of the references used for the video today in case you're interested in checking it out. These are some more of our references and our last slide of references. Thank you so much for listening. If you have any questions, please feel free to reach out to us at the clinic. You can reach us by email to drcurnew232@gmail.com, which is provided on the slide below. Thank you so much for listening.